constant chronic stress that we live in, all of us in this country, that causes our blood pressure to go up and damages our blood vessels and can cause arrhythmias and all kinds of, negative health effects that come from stress. And so, number one, we don't do a great job educating people about stress and what it does. And, we say stress is bad, but we don't really teach people what is happening on the inside biologically. And I think that's really the first step to getting people to address stress.
Hello, and welcome to 20-Minute Health Talk. I'm your host, Sandra Lindsay. Today, my guest is Dr. Tara Narula. She's a renowned cardiologist with Northwell Health, a guardian of our physical hearts for many decades, a chief medical correspondent for ABC News, and the author of her new book, The Healing Power of Resilience, a new prescription for health and well-being. Welcome, Dr. Narula. It's such a pleasure to have you here.
It's lovely to be here with you.
And to be in my studio. I feel like you're always in my living room. And now I get to have you all for myself to talk about resilience. Yes. A topic that I love. There's so much to unpack here. So let's jump right in. As a cardiologist, you've dedicated, your career to the physical heart. And now with your book on resilience, you're exploring what many might call the emotional heart. So how do these two hearts, the biological and the emotional, intersect in your understanding?
I mean, that's the crux of really part of the reason why I really wanted to write this book was to do a better job at educating people about the mind-body connection. So we call it the emotional heart and the physical heart, mind-body, however you want to label it. But essentially what you feel, what you believe, what's happening up here has a real interplay and interaction with the physical heart. And there's crosstalk up and down, back and forth. And so it's so important that when we address someone's physical health, we don't forget about the mental health. And so often as a doctor, we don't ask people about their stress or their mental health. And so by ignoring that whole aspect of what's happening to them and how they're feeling, there's no way we can properly heal them or treat the physical. And so we just need to do a better job really bridging the gap between these two worlds. And that's really what I hope the book is sort of a bridge between psychology and clinical medicine, which, Sandra, I feel like have been just totally disconnected. The psychologists do their research, clinical medicine practices the way we practice, and no one is really connecting the dots and linking them together and really saying we have to kind of do a better job addressing both at the same time when we're trying to help patients.
So what drove you to doing a research and writing a book about resilience?
Right. Why does a cardiologist write about resilience?
Why does a cardiologist, you expect diet and exercise and all of the stuff that we need to do for heart health. Why resilience?
I think it was for multiple reasons. I mean, first of all, it's something that I've seen my entire life. I witnessed resilience in my own family's journey. My father as an immigrant and his story and what he lived through and what he taught us about survival. I saw it in my own life with my own personal challenges. And then I wear these two hats of a physician and a journalist. And so I would be interviewing people. For example, actually, I did a wonderful interview with Chethan, where we sat at a round table with parents who had lost their children in some sort of gun violence episode, whether it was died by suicide or at Sandy Hook. And I sat there with these parents who've basically face the unimaginable. And you wonder as a parent, how can anyone possibly
that must
go
have been very difficult
when you have suffered the most horrendous loss. So I'm hearing these stories and I'm seeing these people pick up the pieces and move on. And then I'm going into my office and I'm talking to patients who have suffered the unimaginable, a massive heart attack, a stroke where they can't move part of their body, heart failure that's left them, crippled. And you see them still thriving. And it was really that question that I just wanted to answer about what is it that really helps us thrive and have quality of life and meaning in our life, despite the fact that we have faced or will face or do face challenge. And that challenge comes at us, Sandra, at all points in our life, in every aspect, whether it's a financial loss, a divorce, a death,
a pandemic
or a health challenge.
Right.
And I really felt like we don't identify medical diagnoses as health challenges. We don't say out loud ever that when we tell someone they've been diagnosed with something, that is essentially a traumatic event.
Right.
In the same way that all of these other events are traumatic. And so the response we have in our body of stress is the same. And we have to do, again, a better job at really counteracting that response. But it was, my own life's journey and really seeing resilience in every aspect of my life that made me just so interested in that concept. And so when I was at CBS News, actually, I said I really want to do stories about resilience. And I did 2 taped stories about resilience, which really kind of became the first part of my journey into resilience. And then when I got approached actually to write a book, it was not about resilience. I was asked to write a book about COVID and diets. And I said, I can write about COVID and diets. I'm a cardiologist. And they said, well, what do you want to write about? And I said, I want to write about resilience.
That's awesome. Well, I'm happy you did, but let's back up for a minute because we use the word resilience, I think, loosely. So what is resilience? Let's define it.
I think there's no one standard definition. And when you look at the psychology research and the researchers, you're going to get a little bit of different definitions from everyone. And so when I was writing the book and really trying to put together what is my definition of it, it certainly was not, I think, what a lot of people think of, which is sort of going back to who you were. Something happens, bounce back. I got to get back to who I was. And again, that was something that came up so often in my office, when I would walk in the exam room and I would tell someone, you've just had a stent or, your heart function is 30%. And it was the same look that I saw in everyone's faces and the same question, which was like fear. And they would ask me, when am I going to feel like myself again? When am I going to be myself again? And so as the doctor, I would sit there and say, you're not going to be yourself again. I can tell you the fear will get better as time goes on, but you will never go back to who you were. But you can become a new version of who you are. And I think that was really kind of the seed of, for me, what resilience is. It's this concept of creating a new version of you, bouncing forward, as I like to say, into the same you, but a little bit different, but really someone who's able to kind of suck all the meaning and joy and quality out of life. Because at the end of the day, that's what we want. That's what my patients want. That's what I want, that no matter what happens to us, we can still be an active participant and derive enjoyment from life. So that is what resilience is.
So it's not the rubber band effect where you bounce back. It's a push forward. It's growth. Then.
Exactly.
So is it innate? Is it something we're born with, a learned skill? Or is it more like a muscle that we must continuously strengthen and adapt throughout our lives?
It's really both. And again, I think that's what was so interesting to me is that I think so many of us walk around and we think if something bad happens to me, I'm going to fall apart. I can't take it. I'm going to crumble. And when I spoke to psychologists who've done research in this area, they would say, actually, it's a very small percentage of people that develop PTSD, for example, 10, 12%. The rest of people, when they are faced with some challenge, do not go onto a path of PTSD. So much of who we are is hardwired to be resilient, which I think is fascinating and really important for people to know. But the second part of that, which is equally as important, is that it is something that you can strengthen. It is a skill. And again, the psychology research bears that out. This is something that we can teach people. We're not doing it right now. And that's the hope with this book. But, there are small pockets, small places where they are doing that. But we've seen it work. And there's no reason why we can't continue to educate people that they can build resilient skills like a toolbox so that the next time something happens to you, you are already habitually in the headspace of, I know what to do because I've done it. And so it becomes habit to use those skills.
And we're going to get into those skills a little bit later. But you mentioned before that resilience, you described it as a crucial bridge between mind and body. Can you elaborate more on this connection and how does this cultivating emotional resilience physically manifest in your health? And conversely, how does physical well-being impact our capacity for resilience, in any event, but especially from a cardiovascular perspective?
Yeah. And I think, the title of the book is The Healing Power of Resilience, right? So the idea is when somebody has a traumatic event, right? Whether that is as I mentioned, you lose money or your business flops or you're in a tornado and your home is destroyed, or someone tells you you have heart disease, right? Your body reacts in the same way with a stress response. Stress response. That is our hardwired, innate way that we survive. And the problem is that we in American culture and society are constantly living in a state of stress. We're turning on that stress response that is meant to help us survive, escape in the wild from a lion and then turn it off. We're turning it on all day, every day for little stresses. And that is where it becomes damaging. The constant chronic stress that we live in, all of us in this country, that causes our blood pressure to go up and damages our blood vessels and can cause arrhythmias and all kinds of, negative health effects that come from stress. And so, number one, we don't do a great job educating people about stress and what it does. And, we say stress is bad, but we don't really teach people what is happening on the inside biologically. And I think that's really the first step to getting people to address stress is teaching them. And, we now are starting to use imaging to see different pathways when we're under stress light up at the same time. So with PET scans and functional MRIs, we can see the brain light up, and we can see the inflammatory cells from the bone marrow, and we can see the inflammation of the blood vessels. And suddenly you have this picture of stress, and it becomes very clear how negatively impactful it is, right? So that's, I think that's step one, is really teaching people this is what stress does and this is why it's bad. The second is that we have agency and control to dial that down. And that is where the resilient response comes in. It's saying, if something happens to you and you create that, you can use these tools and these pathways to turn off the inflammation, to dial down the stress. And not only is that going to help you recover from a traumatic diagnosis or an event, it's actually prevention. So we equally could have called this book The Preventive Power of Resilience, because you think about it, if you are somebody who is mentally in a better space, you are going to stay fit and exercise, which is going to be preventive. You're going to have social support, one of the tools we talk about, that's going to buffer you against some future stress. You're going to have meaning and purpose, which is going to dial down your stress response. So it kind of goes both ways. If you are more resilient, you're going to be protected and you're going to have prevention from disease, and you're also going to be able to recover better from any disease process.
Interesting. So we have authority over our reactions.
We do. And we have so much more control than we give ourselves credit for. And it's not rocket science. It's simple things that we can do to kind of build that up.
And to our audience, they're going to have to stay with us, because we are going to talk about what those things are that we can pull out of our toolbox. But before we get into that, when you were doing your research, did you have any aha moments, or did you identify any common misconceptions that we have about resilience?
I think that the aha moment for me was that we're just missing the boat in medicine. We're missing caring for people in the way that we should be, and again, it's because, I was writing the book and I was seeing patients and I felt like I'm handing them a script to tell them to go see a nutritionist or to go to cardiac rehab or to go to a smoking cessation program. And why don't I have something to hand them to tell them, here's how you can build resilience in this time of need where you're lost and you're scared and you don't know how to take that next step forward. And so I just felt like there's this huge void that is missing, and it doesn't have to be that way. Medical institutions, hospitals all over the country, Northwell, I actually brought this to our leadership, should be creating resilience training programs for patients. There is no reason that this should not exist, because I would like to give that to my patients, to hand them that, to say, for the next 12 weeks, you're going to be enrolled in a program that's going to show you how to navigate your new diagnosis and what is your new life and your new world. That was the aha moment.
So as you are practicing and you're learning, as you're doing your research, did your practice kind of shift as you went along? Or
cardiology, I will say, is ahead of the curve in terms of recognizing the mind-body connection more than I think a lot of other fields. And we do ask people, or I do also in my intake with my patients, are you stressed? What do you do to manage stress? Do you have depression or anxiety or PTSD? What is your mental state like right now? So that I know how to help them, right? So we have to ask the questions first. And I know at Northwell, we talk about depression screening, which we started to roll out. Fantastic, right? We have to actually start asking the questions and picking up on it before we can ever even refer someone. But then I think, yes, we have to be able to then build in something on the other side that we can actually give to people to help them on that health journey.
Well, I have to say my primary physician is also a cardiologist, Dr. Nevber Simileton, who I've been going to for years. And she's always asked me about my stress. What's bothering you?
Yeah. Well, that's what people tell me. The first question I ask when I open the door, how are you?
Yeah.
And the first answer I get from 70% of the patients I see is, I'm stressed out. I'm depressed. I'm anxious. They're not telling me my blood pressure is 125 over 90 or, I'm not exercising as much. They're telling me about how they're feeling because they're overwhelmed. And that is what is on their mind. And so how can I possibly get them to take their medications and do all the other things I want them to do when that's the focus? So, so much of my conversation with my patients is about therapy and about addressing their mental health. And I wish, again, that was something we had, better hold over. We had more mental health care practitioners. So many people tell me, I can't get in to see a therapist. I'm trying. I can't find one. It's a sad situation when the number one thing that I'm hearing is about their mental health as a cardiologist, and I don't have a place to send people.
Wow. Well, let's go into now, beyond the theoretical. What does resilience truly look like in action? On a Thursday afternoon, on the weekend, during a snowstorm, or, you get in bad news. What does that look like? Can you share concrete examples of 2 or so things that someone might draw on their resilience to navigate a challenge of any sort, whether big or small?
Yeah, so the whole second half of the book is really focused on the tools, practical steps. And, the first half is about stress and the effects on the body and the resilient response. And the second half lays out what you can do. And I wanted it to be simple. My life as a medical correspondent and journalist is about taking complicated information and making it easy for people to understand. And I wanted this to be like a roadmap, a checklist that someone could easily go through their mind and say, okay, step 1, I'm going to do this. Step 2, I'm going to do this. This is not rocket science. And sometimes some of the easiest things are simple. We just have to put them out there in a way that people can start to use them. And so for me, there were 8 things that I felt were important as the kind of the tools, and they were purposefully laid out in an order that I felt should be followed. And so the first one is acceptance. Before you can ever do any of the other tools to become resilient, you have to accept whatever has happened to you. And, I tell the story in the book, and I've told it before, about my own journey as a patient when I was in medical school and I lost vision in part of my eye. And no one knew why. And I was very scared. And I was at the beginning of my career, and it was terrible. And for me, my mother sent me the Serenity Prayer, which I've saved to this day on a card. And the very first line is, God grant me the serenity to accept the things I cannot change. And so, that to me is the beginning of opening the door towards everything else, as first being able to say, I take what's happened. I know I can't change it, and I'm going to accept it. And I hear that from my patients as well. So I think acceptance is purposely the first step in this process.
We want to thank Dr. Narula for spending an afternoon here with us on 20-Minute Health Talk. We will invite her back next week to continue this conversation. Until then, I'm your host, Sandra Lindsay. Be well.
Resilience is the ability to bounce forward from a challenge and create a life that is full of meaning and joy and excitement.
And love.
And love, yes.
What are are some of the other tools that we need to have in our toolbox?
Right. So as I mentioned, so acceptance, flexible thinking, getting fit. So, the third tool we talk about is really that physical part of your body and how that then interplays with the mind, the backwards sort of scenario there. So by exercising and eating right, nutrition, and sleeping, you're building your resilience and you're supporting and strengthening your mental health. So we talk about that in the book. I use an example of one of my patients, several of my patients, but who really, turned their life around I have a patient of mine who's a producer. He has multiple stents, heart disease, and he was obese and diabetic, and he used his heart disease is an opportunity to really wake up and change. And he lost, 60 pounds, and he's run 2 marathons. He has the word resilience tattooed on his arm now. But he and so many of my other patients are that story of how much you can physically change the way you are and where you are right now. And that is going to help you on your journey with resilience. And then I think the fourth tool that we talk about is facing your fears. That's a big one. And I mentioned therapy, but I think therapy can be extremely helpful for people, whether they have a diagnosed mental health condition or not. Just yesterday, I saw a woman who was telling me about all her stress being a caregiver to her aging parents with dementia, her children, her job. And I said, you should see someone. And she said, well, I don't have anxiety or depression. And I said, but you have a ton of stress and you can't handle it. And you need someone in your corner that you can just download with, that is not going to be veering one way or another,
non-judgmental,
totally non-judgmental,
neutral,
that you can just talk to, right? So I think the more we can steer people towards therapy, and whether that's talk therapy or ACT or CBT, I mean, they're all different kinds, but really powerful to be able to move beyond fear, because fear can get us stuck, right? Fear, whether we've had a bad relationship or a lost business or a diagnosis, and we can't imagine a life beyond the fear that we're in. So that's really, those are the first kind of 4 tools that we talk about.
Awesome. Well, you mentioned a little bit about this, an event in medical school, but are there any other events, personally or professionally, that you've had in your life where you had to really lean into resilience? You had to go into your toolbox and pull some of these tools out?
I mean, all the time, right?
Yeah.
And that's why when I was writing this book, obviously it's told in some ways through the lens of being a doctor and why this needs to be part of patient care, but it is meant absolutely for anyone facing any challenge. And so as I was writing this book over the last 5 years, and of course during my life, of course there have been, challenges, whether that's with my family or my work or my kids. And at every point along the way, I would think, okay, I have to accept this. I have to, I can't stop exercising. I'm going to lean on my social support. I'm going to lean on my faith. I'm not going to lose hope. I'm going to keep doing what I want to do. So I literally thought through all the steps in the book as I was facing my own challenges, and of course, nothing as bad as losing, thankfully, vision in my eye as I did in medical school. But, we all have things happen to us. And, riding the waves of life from one day to the next, you never know.
Yeah, especially now. There's so many things coming at us.
Exactly.
During the pandemic, I leaned in on my faith. Social circle. I never used FaceTime before the pandemic. It was my best friend to connect with people all around the world. Laughter for me. I went back and I watched Girlfriends and I watched Schitt's Creek and I just laughed. And it didn't matter what time I got home. I had to go out and just walk to clear my head.
Totally, yes. I remember the pandemic.
Yeah.
We all remember. I was here in the city with my husband, who's a physician, and our 2 kids in our apartment, and the city looked like, a bomb went off and no one was here. And we were seeing patients, and it was scary. And I remember saying, every day we're going to go to Central Park. We're going to get out of the apartment and we're just going to go and be in the trees and the fresh air. And that was like very much what saved us, was just be able to get out. And I would say to my kids, we're going to do a little what do you call it? Like a obstacle course in the park so that we can exercise, you know? And so, I think the pandemic was a great example of really drawing on resilience. We had to for all of those reasons and in so many aspects of our life.
So we often discuss, Tara, resilience as an individual trait, a personal journey, but how much of our capacity for resilience is intrinsically linked to our support systems?
I mean, you know, the second half of the book, I have a chapter on social support and social connection, and I have one on love. And
I want you to expand on that. You mentioned resilience and love.
Both of those were very important to me. And I will say, you know, the psychologists don't often talk about love. But for me as a physician and in my life, I know that that is an important tool. And again, it's because I see it. You know, I have so many patients who will come to my office together, husband and wife, and the wife or the husband is literally picking up the other person and carrying them through this health journey. And then sometimes it reverses, but you see it in action. You see how that support matters. I see it when parents come in with their children and the children are right there by their side saying, you know, no, mom, let's do this, you know, and it's that deeper, more intimate connection. Social support important, but that deeper intimate connection is life-saving for so many people. And so that is critical. And then, yes, our wider social network. And, you know, I've had patients, same thing, tell me, you know, I had a patient, I told the story recently, who had retired from his job and was smoking marijuana, felt depressed, not in the greatest health, and was kind of spiraling. And he said, someone said to him, you know, Central Park has this group where you can go out and, you know, trim the plants and clean up the garbage and be outside. And he said, I don't know why I joined it, but I did. And he said, I go now 2 days a week. And just that community saved me.
Life-changing.
Life-changing. I had another patient who went in for a routine surgery, came out blind, 70% blind by something that went wrong. And when I saw him initially, he was just totally broken from what had happened. And I just saw him about a month ago and he was he's still mostly blind, but he was smiling and I could see there was a lightness in him again. And I said, how did you get to this point? And he said to me, acceptance. And he said, my friends. He said, my friends who still joke with me and take me out fishing. And they have helped me in more ways than anything else. So, you know, these things matter. And there are little steps that everyone can take, little tiny changes, joining a social group, you know, joining a club, calling your friend, calling your parent or your loved one, making that a priority is key.
Awesome. So, you know, you mentioned the resilience paradox in your work. Can you explain what that is and why understanding it is so important for anyone trying to cultivate resilience?
Yeah, I mean, you know, resilience is something, as you mentioned, that I think people they just don't understand what it is. We use the word so much, but I think really understanding that the more resilient we are and the more we build it, the more resilient we're going to be in the future, that it really kind of builds upon itself. And so my hope is that this book may be my last book, but if there is another book in me, it will be a children's book. Because I think
that would be a great book to teach children from their young about how to cultivate resilience.
It just becomes ingrained.
Yeah.
Because part of how their brain is wired, it fires in that way so that when something happens, you're automatically going to that place of being resilient, right? I just think it needs to be taught, you know, to all of us. It needs to be taught at a younger age. And it needs to be understood that this is something that we all have in us that we can strengthen.
Awesome. Well, then you'll come back and we'll talk about that. Well, I'll be around. We'll talk about it then because, you know, I enjoy, you know, talking about resilience because I'm from Jamaica. We talk about it all the time, that we're a resilient people. We just went through a major hurricane and people are rebuilding and, you know, picking up the pieces and hopefully growing, not bouncing back to where they were before the hurricane, but growing. But I have to ask you this. Do you think we confuse endurance with resilience?
I mean, possibly, in the sense that I think sometimes we think if I just like keep going, blindly without addressing, anything. Just pick up the pieces that, I'm going to be okay, or that's okay. And I think it's not okay because you're not addressing all of the feelings that you're having inside, right? That don't just go away. The fear,
you're not accepting
the loneliness.
what is happening.
No. So just sort of like with blinders on, kind of continuing to put one foot in front of the other is very different from saying, I'm going to use this as an opportunity to actually kind of figure out how I'm feeling and how I can be feeling better and what I can do to kind of strengthen my capacity to grow.
We talked about this before, where you mentioned the physical aspects of our lives, sleep, movement, nutrition, directly impact our mental and emotional capacity for resilience. But are there any specific ways these factors can deplete it?
Well, I mean, certainly if we're not exercising and eating well and sleeping well, we know that, again, that has massive effects on our physiology, right? So certainly we talk about that in cardiology all the time. Those are part of life's essential 8 the American Heart Association talks about is, eating well, sleeping well, and exercising. Actually, in my conversations with the AHA, I said, you need to have life's essential 9, and the 9 should be stress and mental health, which I found kind of fascinating that that's actually not in there for all the reasons we talked about earlier. But those factors, again, it's the back and forth interplay, right? When you eat better and you exercise and you feel better, it makes you more able and wanting to go to your doctor's appointments and to take your medication and to maybe go out and see a friend. And so it's this circular relationship between doing those and staying resilient and doing those.
And finally, Tara, on a broader societal level, how do we think about fostering resilience in communities facing chronic systemic challenges? There's so much going on right now. People are facing poverty, discrimination, environmental crisis. What is our collective responsibility in building such resilience?
I mean, we have a huge responsibility. And I think that's why I said, we need to be training people, whether it's children or hospitals or everyone, to use these skills, because these skills are applicable to everyone everywhere. And right now is a difficult time. We talked about when I asked my patients about stress. I mean, now everyone tells me they're stressed because of the state of the world right now, our country right now. It's really difficult. And so I think, I think changing the lens from saying this is like a bad situation and I'm stuck to saying this is a bad situation, but I have control and power over these factors. I think giving people power, empowering them is so critically important because we can't always change our circumstances.
Right. But we can change how we react.
We can change how we react.
Right.
Exactly.
And whether we want that overwhelming stress response, which is harmful to our bodies.
That's right.
Or do we maintain authority over a situation?
Right.
Accept it. Move the goalposts. Eat well. Move. Sleep,
love,
laugh,
yes,
and figure it out. So, if I may engage you in some rapid fire questions to close this out, I could go on and on and on, but I'm going to save some for when you come back and we talk about the children's book. But can mindset influence physical health?
Oh, absolutely. For sure. Again, for all those reasons that we said, what happens up here and that pathway that connects, the brain and epinephrine and adrenaline and cortisol and, all of that, there's a connection there that elicits a response. And so absolutely there is that connection of mindset and physical health.
All right. What's the most underrated resilience habit?
Oh, gosh, underrated. The last one in the book, the last tool that I talk about is purpose. And I like to always say that to me, that's like the lighthouse. And, so many people live their life without really living in their purpose. And I think in other instances, something happens to us, a challenge, and it opens our eyes to say, I'm going to live what I should be living. The reason I'm here, this is why, and I'm going to do it. I'm going to go after whatever it is that I'm passionate about. And then sometimes something happens to us and we say, now I'm going to do this because I want to be an advocate for whatever this cause is that I've faced, right? But that purpose is so powerful in terms of really pulling us forward and giving us that light and that hope when things look really dark. And so I think purpose is a really underrated one, but I think it's really powerful in terms of guiding us forward.
Amazing. What's the biggest hidden drain on resilience?
Oh gosh, hidden drain. I think we get in our own way, probably. I think, thinking that we don't have so much control, that we're doomed. Well, I'm not an optimistic person, and so I can't do this, and I think we almost get in our own way sometimes from recognizing how much we actually can do.
One sentence definition of resilience.
Resilience is the ability to bounce forward from a challenge and create a life that is full of meaning and joy and excitement.
And love.
And love, yes.
One step someone can take today to build resilience.
Yeah, I think the social connection, I always say, is like the easiest one. We all have people that we love and care about. Maybe we haven't talked to them recently. We haven't picked up the phone or made it a time to see them in person. Or maybe we have something we enjoy doing, but we just haven't joined that group, right? So those are the little changes that everyone can start to do. I think that will be so impactful and easy to accomplish quickly.
Dr. Narula, congratulations on your book. Thank you so much for joining me in studio today. I feel so special. And thank you for sharing your invaluable insights and wisdom today. Really, really appreciate it. The healing power of resilience offers such a vital perspective, beautifully connecting our physical and emotional well-being. We deeply appreciate your time.
Thank you so much.
And to our listeners, thank you so much for tuning in to another series of 20-Minute Health Talk. I am your host, Sandra Lindsay. Until next time, be well.